you all.
And namaste and good evening and salamat malam teman-teman and friends once again. Welcome all to the COVID-19 Be Careful, Not Fearful, an informative session on the pandemic at large scale here on Manthan with Saraswathi. After my own traumatic experience with the coronavirus this past year, I have realized that there was not a lot that I knew about the prognosis of this virus and how to cope with it. It certainly caught me off guard, as I did and still does thousands of people around the world. I was extremely fearful and anxious. It was extremely overwhelming. I know. I couldn't have made it through without the watchful eyes of the two super specialty doctors whose meticulous care and advice helped me recover. I'm so glad to have them here with me at this moment to discuss about the virus and how could you cope up with it personally. Welcome to Manthan with Saraswathi, Dr. Rajesh Shavi and Dr. Ganesh Prasad. We have had a lot of questions coming up. We had posted this a long time before, and we had a lot of questions. We will all be dealing with the questions, and we will be asking Dr. Shavi and Dr. Ganesh Prasad a lot of questions, which has come from my friends. Dr. Radha is joining us. Welcome, Dr. Radha. So we have a lot of questions, and these will be answered. But before that, let me introduce both doctors who are so excellent in their profession and they are so meticulous. Thank you once again, and let me introduce them to you, and then can the screen be seen? Okay.
Yes, ma'am.
Okay, now first let's start with Dr. Ganesh Prasad. And he is a consultant nephrologist, Fortis Healthcare, Vadapaini, Chennai, India. He is joining us from Chennai. Dr. Ganesh Prasad, hello there.
Hello everybody.
Thank you. Let me finish the introduction and then it's going to be with you. Dr. Ganesh Prasad is a nephrologist with over 30 years of experience. He has had vast experience in renal biopsy, CAPD, various types of kidney disease, kidney transplant across blood groups and critical care. He is fluent in Tamil, Kannada, Telugu, Malayalam, Hindi, Sanskrit, Marathi, and of course, English. In his spare time, in his free time, he is proficient reader, badminton player, and enjoys scuba diving. Actively participated in various academic meetings, CME programs, seminars conducted at state level, zonal level conferences in the field of internal medicine, neurology, nephrology, and respiratory medicines. He served as a medical director and consultant nephrologist to Meot Pacific Hospitals at Suva, Fiji. And he has also participated in various programs in nephrology at Boston, USA, Harvard. And that was about Ganesh Prasad. I'm sorry, the screen was going up and down. I'm not very used to it. So I hope you will all bear with me. And then we are going to Dr. Rajesh Shavi. Hello there, sir. Good evening.
Hi, good evening, ma'am.
Dr. Rajesh Shavi is a doctor from Jawaharlal Nehru Medical College, Belgaum. He's finished his DNB General Medicines at St. Martha's Hospital. Dr. Rajesh Shavi is a general physician and consultant physician and has an experience of 30 years in his field. Dr. Rajesh Shavi in Bangalore has made a rather exceptional name in the city. According to many doctors, class he is classified as one of the go-to general physicians, and this is very, very amazing. He is a member of Indian Medical Association, IMA, and has over the years treated patients with various viral fevers, diabetes management, and over the past years treated hundreds of patients with coronavirus symptoms, etc. Consultant in the Department of General Medicine at St. Martha's Hospital, Bangalore. He speaks English, Kannada, Hindi. He is a consultant physician and a diabetologist. Welcome, doctors, to my show. Thank you very much for being here to clarify, those many questions which has come in. So right now, thank you very much once again for being here, and I will hand over the mic to Dr. Ganesh Prasad for his presentation. Dr. Ganesh Prasad, over to you.
Salamat Malam for everybody. Good evening, everybody from Chennai. Here, Dr. Ganesh Prasad here, and I'm very happy to be a co-speaker with Dr. Rajesh Shavi, my best friend. We were both close pals in Jawaharlal Nehru Medical College. That's how both share the 30 years of experience together. And if I am experienced in my place, he's also equally experienced in his area of interest. And we share quite a few things in common. Of course, including shouting at times in joy. Okay, I think that is of the need of the hour, especially in the Corona times. We have to keep our mind light and the heart light to go on and carry on in our profession. And to make it short, I am just here to present a small PPT slide. The plan is to make people aware what is this coronavirus, and just to, of course, few of the things which I'm going to be presenting in the slides, we'll also be addressing a few of the questions that has been posted by various people in interest of coronavirus disease in this pandemic now. So I have divided into a few topics like interaction, a small biology of the virus, and of course, what are the symptoms and how it gets carried into the human being. Everything is in small way. And of course, what are the vaccinations available, and of course, what are the myths, etc. I think this will be, in short, answering most of your questions that has been posted by members who are in this particular meet. Before that, I should thank Saraswathi for inviting both of us for this forum. Though I don't know we are very qualified for this to be expert in this particular field. We have been seeing coronavirus disease, but the last word is nobody is expert in this field. So be as it may, I will try to make this presentation as requested by Dr. Saraswathi, and I thank her for this particular evening and this talk. So let me go ahead with this talk. So before this, I should say why this particular topic is of interest. I felt this topic of today's pandemic is of interest to speak to all the people especially in Indonesia, for this following reasons. There's an escalated globalization. I knew most of our Indians are there in various places across the world. There's an expanding human population, increasing human-animal interactions. Of course, there is an altered ecosystem clubbed with viral recombinations. There has been a change in the nucleic acid or a genetic mutations, what we call, where all this globalization or traveling, etc., reassortment that have led to emergence of several novel pathogens that have been wreaked havoc, not just the global economy, but also very existence of healthy life, especially in this pandemic. The emergence of global pandemic COVID-19 has exposed the Achilles heel of our preparedness towards unexpected epidemics and pandemic, despite use of spatial epidemiology and mathematical models to predict such emerging and re-emerging pathogens. We have been caught wrong by most of the mathematical models. The coronavirus has little been tricky for these mathematical models the scientists have been applying through. In the era of universal distrust and the rising global tension and the overload of information, it becomes eminent that we, medical fraternity, aid the public in shifting out the facts in the midst of skeptically scrutinizing every bit of life scientific research that is disseminated globally without ourselves getting swindled by the availability of bias in this area. So I thought this is a pertinent talk to be given to especially our own fellow countrymen who are away from this place and are looking for some support in our places. Hello?
Yeah.
Screen is not shared?
No, the screen is not shared.
Please share your screen.
Okay. Now?
Yeah, we can see your screen now.
Okay. So
you can
the
go
rise
from
in
slide
global...
You can go from slide number 1 or slide number 2. Yeah.
So the global panic that is because of its financial market hysteria that has been happening, and the constantly evolving data of SARS-CoV with misinformation that has been only making us petrifying in pandemic more grimmer. Our one bastion of defense is concordum of wild word dissemination of truthful and accurate scientific data. The knowledge of the disease is changing so fast that we seem truly today, not that everything we know about this particular virus might not be so in future. This is a disclaimer from my side that our knowledge of this is still in continuity, not that we know everything about this pandemic, but be as it may, I just go ahead with this particular talk. But we should give credit to this particular virus. I think he has given a lot of things that has gone through in many places in terms of its innovation that is coming up for its treatment, innovations in terms of its implication that has been going across the world on economy, the research, everything. So I think we should definitely, I think in a way, thank this COVID-19 virus, without which we not have been so innovative in our thinking, and our daily life has totally been changed by this. And you should be surprised. There is a new area of interest that has been coming up called as theranostics, which is a newer discipline in science focused on detecting, eliminating viral and bacterial threats using nanoscience technology. See where the science is taking us up with this COVID pandemic. There's a huge invention that is coming up in nanoscience technology. They're looking at impregnating even the PPE mask, the mask, etc., with some sort of an ionic thing so that we can get protected by the COVID-19, not just COVID-19, in other viruses too. And this has led to a lot of other sort of a meeting, even of course, among our own nephrology fraternity. We have been attending every day some sort of a workshops, interactive workshops. We're able to get connected to our experts, which we were not able to do it before the pandemic. And I should say there's a develop of collaborative local and global network clinical leaders to enhance our patients' care has also been concurrently going. That's how we have been able to treat patients. And our fellow educators, like I think Saraswathi is also a keen educator, sharing knowledge and through online content creations in our own way. I think this has also been one of a huge thing that has come up after the onset of this pandemic. I think we should thank the COVID virus for this, if not for the death that has mortality that has been causing in its own means. And the blueprint of this virus is not new. Given the potential that it causes a public health emergency it has caused all these years, the absence of efficacious drug, vaccines, or both is still an urgent need of acceleration of research and development, not just COVID-19. We have quite a few set of viruses even today, which are still untested in terms of its treatment, the vaccination, or management. For example, the Crimean Congo hemorrhagic virus, the Ebola virus you must have heard here and there on the news, the Marburg viruses, the Lassa fever, the Middle East respiratory virus of the coronavirus family, and severe acute respiratory distress syndrome virus, once again of the coronavirus family. You will be aware that has been coming through Singapore and Saudi Arabia or Middle East countries. This is almost the same as what the coronavirus has been causing today, but in the lesser scale. The Nipah and Hep Nipah virus is also one of the areas where a lot of research is need to be done in terms of its treatment and prevention of the disease progression. There's another one called as Rift Valley virus, the Zika virus, and here comes the COVID-2, SARS-CoV-2. And if you look at the virus pandemics over the last 100 years, you can see the mortalities has not been less as what is happening even today. The North American H1N1 virus that happened in 1918, that of the Spain, they took away a lot of human populations away from this earth. And this is one of the largest pandemic that happened in 1918. And we have been seeing such pandemics throughout the globe over the last 10, 15 years in gaps. Like we had this Brazil Zika in 2015, and we had this Central African Ebola virus, the MERS, as I said, the SARS-CoV-2 once again happened in 2003 in a lesser scale. The Malaysian Nipah in 1998. The Hong Kong had H3N2, or sort of a swine flu virus in 1968, and so on and so forth. So little biology. I'm not going to take you details of the details of my talk into the biology of coronavirus. Be as it may, it is like the coronavirus doesn't get into the body just as it is. It needs some fulcrum. There is something called as ball and socket type of receptor in the body, in the tissues where the coronavirus is going to land at. And this is, can you just mute off those sound that is coming up from the background, kindly? And this coronavirus had to get adhered to your tissues through two proteins called as ACE2 protein and TMPRSS protein. I'm just taking you to tell you that there are new areas of interest where we can try to protect this particular pegging of this virus onto the tissues by blocking this or making more robust of this particular two proteins that actually invites the virus onto its surface of the body, and that takes it inside the cell by a process called as endocytosis. It is just like a sucking of a particle into a cell, that once it's into the cell, the virus starts multiplying. Once it multiplies, it destroys the cell completely. That means the cell where it goes, it kills the cell. It is like telling you a guest who comes, unwanted guest who comes into the house, he kills away all the guests but takes the whole house into his control. Very similar is this particular coronavirus. It enters into the cell, destroys the cell, multiplies itself into the cell, and then destroys the whole cell for its own betterment. And it is not surprising that the coronavirus doesn't just attack the respiratory cells. That means that is the lungs and the nostrils. The receptors, what I said as ACE2 receptors and TMPRSS protein, are more in the colon, more in the gallbladder, heart, kidney, and less compared to that of the lungs. But be as it may, the lung, the nostrils is exposed to the virus easily, and that enters into the nostril of the person, and there it starts replicating into the nostril epithelial cells and destroys the cell, but then it multiplies and gets thrown out, and it starts throwing out as a viral shedding. So when the person inhales this virus through his nostrils, it sets first into the nostril itself, replicates there, and then can get thrown into the environment. And that's why people were afraid to go near an infected person, because the sneezing, coughing, or even puffing his nose can throw this virus that is replicated into the aerosols or into the air spaces, and the next person next to the person can get infected by this virus. So this is very important to know the exact route of entry. But the route of entry is also through the intestine. It can go to the intestine, get linked to the colon, multiplies into the colonic cells, and similarly it gets shed into the motion. And this is known to happen and cause infection even through the secretions that comes out of the notion. If you look at this, if the ACE2 protein were not to be there or very robust, the virus can't cling into the cells and can't enter into the cell. So we need to do something to make this more robust. I think scientists are working on this particular area. Somebody in the group had asked about what is immunocompromised or immunosuppressed person. Immunocompromised or immunosuppressed person is that they have an adaptive immunity being impaired. We have some resistance against organisms or any microbes that enters into our body. Those resistance cells fights against this particular microbes or invasive cells that tries to go into our body by this mechanism called as immunity. We just like a country has got a three major defense mechanism like Army, Navy, and Air Force. We ourselves too have a two major defense mechanism called as T cell response and B cell response, similar to Army and Navy. And whenever any organism tries to enter into our cell, this particular defense mechanism gets activated. And once this defense mechanism gets activated, if we have a robust immunity, the viruses can't enter into our cell. Ironically, this COVID-19 virus acts very similar to that of HIV virus, AIDS virus. That's what I mean. What it does is it literally mesmerizes or impairs this defense mechanism in the body and completely kills our immunity. Similar way that what the HIV does to the human being. That's why HIV is called as human immunodeficiency virus. It basically impairs our immunity, and SARS-CoV-2 also causes similar impairment of immunity. So if anybody who has got an impaired immunity, these viruses can definitely get into our system and play havoc in the whole body. That's how I think we call it these people as immunosuppressed or immunocompromised, because these people are not able to fight against this virus. As I said, the SARS-CoV can spread through contact, droplet, or aerosols. If the droplet has fallen on any of the tissues or any of the materials that is surrounding that area, and one touches this droplet and touches his nose or nearby parts of his nose, those droplets can enter into the body and that's how causes entry into our lungs or into the esophagus. If it gone through the droplets has fallen into any of the foodstuffs that what we eat, or it goes into the skin. And of course, it can't enter the skin as such, but can be a dormant on the skin. And whenever it comes in entry points, it can definitely cause entry into the cell. What does it do? It has been causing severe pulmonary, that is the lung problems, what is called as ARDS, adult respiratory distress syndrome. The person goes into a distress of his breathing. He gets shortness of breath, difficulty in breathing, can get chest pain and running nose because it starts irritating the nostril cells in the nose and cause a lot of secretions coming out of the cells to basically wash out this organism that has entered into the cell. But on the contrary, the cells in the nose gets completely devastated. The coronavirus comes into the picture and goes out in the aerosols. And we talk about herd immunity. What is this herd immunity? Herd immunity is nothing but a public health term that refers to the fact that when a person, there are enough people in the community who have got adequate immunity against any disease, and you are been living in those places along with these people, then you are unlikely to get into the disease per se, because these people act as a helmet for us. In the sense, they act as a shield so that we don't get, the people who are immunocompromised don't get exposed to the viruses. The people who are immunopotent or immunocompetent, they fight against the viruses and the viruses becomes timid and goes away. But if the viruses gets caught by the immunocompromised or immunosuppressed person, they get into the system very easily. I'm not going to the details of the mechanism of whatever the symptoms that has been seen. I think most of you must have read. Basically, it can cause cough, fever, prolonged intermittent fever can be happening, myalgia, there is muscle fatigue can happen. Some of them have headache, and some of them have what is called as dysgeusia, nothing but loss of taste and or loss of smell. And this can happen in less than 10% of the people. But don't get afraid. There are some other diseases which can cause the similar symptoms. Not that everybody who has got dysgeusia or anosmia, there is loss of smell or taste, doesn't have harbor coronavirus. There's one more word that has come, terminology that has been coined by Chinese. You know, Chinese coin everything first. They have coined this particular COVID virus too also in the first place. They call what is called as toxobocardiomyopathy, otherwise called as lockdown cardiomyopathy, otherwise called as stressed heart syndrome. So even this is a part of a syndrome that has been happening in people who got afflicted with coronavirus. They also cause a lot of other organ system involvement. They can, as an interest of my place, that is a kidney, they have caused multiple patients to have acute kidney insult or acute kidney injury or kidney failure, and they have even caused a prolonged sort of a disease that has been coming up in this particular area of organ system, that is basically kidney. Similarly, there's going to be a lot of neurological problems coming up in people who have been afflicted or who have afflicted and gone. Even the coronavirus has gone out of their body, but then can have some effects, side effects on the neurological system. Similarly, the gastrointestinal, that is the intestine, the stomach, etc. They might have some problems to come. So we need to face those problems. We need to have some corrective measures for these people. So immunocompromised or the immunosuppressed people are basically the old age people, the people with uncontrolled hypertension, diabetes, people with smokers and having a smoker's lung, otherwise called as chronic obstructive airway disease, the heart patients, and of course obesity. Obesity is not just a beauty part. It is a disease. It can invite diabetes, it can invite hypertension, and it also invites coronavirus because they have the little immunosuppressed people, especially with the BMI more than 30, what we call as jumbo. And people who are having some sort of a cancer, they also have very less fighting capacity, and they are also come under the category of immunocompromised individual. So what is this incubation period of this virus? I'll just tell you in another picture diagram that will make you much more betterment of you to understand what is actually this incubation period. Normally, the viruses takes about 14 days for its lifespan of the virus is about 14 days to 16 days. And the median age of its complete replication starts with the day of 5. And then, of course, there can be what is called as interquarantine time, which takes about 2 to 7 days to imply a dispersion. About more than 50% of the people can get into the system. So patients can have, a majority of them will have some sort of a progression or complications by a few of the days, that is 5th day onwards. To tell you on this, the incubation period of this virus might be much earlier than the symptoms that has appeared, which is going to be a much -5 days before the symptoms appears. And the symptoms are like critically ill, severe illness, and of course they can go to take them into the ventilatory state by 14 days time if they are not able to fight up this viruses. Of course, there are a lot many laboratory tests. I'm not going to the details of this laboratory test. This is how the lung pictures are seen in this particular area where the COVID virus can infect, as against the other sort of viruses have got a uniqueness of inflicting the injuries on the lungs. So by looking the CT scan, many of people could come into say that this patient has got the coronavirus. There are very many tests. Of course, the RT-PCR is the main test that has to be relied. It has got a 3 genes that has got importance of its activity called as N gene, E gene, and RDP gene. But there are other things called as RT-LAMP, which is also similar to that of its sensitivity and specificity. Other so 2 more questions that have come in the questionnaire was that other tests, antibody tests, are they sensitive? They are not sensitive, but they tell us whether the person has had some coronavirus in the recent past or is already harboring antibodies. I'm not going to the details of whom to be prioritized. I've already harped upon the people who to be prioritized, basically people who are more than 65, especially the triaging of people whom we say when they come to the hospital. And once again, the triaging can also be based on the symptoms, the early infection and the pulmonary phase, what we call in terms of its mechanism of inflicting the injuries. Coming on to the vaccinations, there are 4 major areas where the vaccination has evolved or vaccination has been made of. The genetic material RNA DNA of the virus has been taken. The vector, the adenovirus vector, has been used as an agent of manufacturing the vaccination. The protein-based virus is once again the whole virus has been used for preparing a vaccination. This is how the coronavirus looks. There are the proteins that has been identified in these areas, and they use the spike protein, those protein that basically cause the clinging into the human cells and enters into the body, and that's how it starts replicating. So once you cause the spike protein to be stopped or hammered out, you probably won't get the coronavirus. That was the basic idea of using this sort of virus vaccinations. And the vaccination, as I said, there are 4 types where they have used these materials for preparing these viruses. In India, we have been using the so-called Covaxin and of course Covishield vaccine. These are basically the vaccine that has been taken out from the spike protein and the plasmid. And there are other viruses also in India are being tried, and they are all in the various trials, which are likely to come up in the recent times in the days. There have been a word about this COVID wave. What is this wave? They're called as outbreaks, sporadic outbreaks. The theory of this pandemic is definitely murkier. And I think there are some papers where they say there is nothing like waves at all. The first wave is the wave that is still going on, and it's not like the 3rd wave, 2nd wave, the 4th wave, or anything. This is because of the human behavior that this pattern of the virus seems to be showing a wavy pattern. Because the COVID virus is never tested 0, and then it has not researched back to say that this is a new wave. The wave that has been there in the first wave seems to be continuing in the little lesser thing, and then subsequently due to its nucleic changes inside the COVID virus itself, it is becoming more potent and robust in its terms of its inflicting the people. I'm not going to the various waves that has been playing in this so many centuries that has been going on with this particular waves. I'm just going to the few of the myth busters, what we have asked. Whether the COVID virus can get caused because of vaccination. No. So you can't get a vaccination causing a COVID virus at all. And vaccination people are definitely safe. In people with epilepsy, yes, it is safer, but you have to contact your neurologist to make sure you're not still in active phase of your epilepsy. People are, especially in my area of transplant, we definitely recommend vaccination with some changes or modulations in the treatment part of the transplanted people. Of course, any surgeries can be done in concordance with your surgeon after vaccinations or even before vaccination. So nothing to worry. Based on the emergencies of surgery, you can just go ahead with the surgery and then think about vaccination later. The short presentation, I think we'll go on to the talk or the questionnaires that has been come up from various quarters of Indonesia and of course among our own countrymen here. Thank you. I invite Dr. Rajesh Shavi for any points from his side to be added on for this talk.
Yeah, I think I will ask Dr. Shavi. And before that, let me thank you, Dr. Ganesh Prasad, for that. It was all in a nutshell. That the entire question, whatever the doubts have come and whatever the questions have come from the friends from Indonesia and from India and from the other places, and I think your presentation was in a nutshell and it explained everything. Now let me I think Dr. Rajesh Shavi would throw some more lights, and then we would go to the questions, in particularly framed by my friends as it is to be addressed in this session. Thank you very much, Dr. Ganesh Prasad, for that wonderful PowerPoint presentation. And Dr. Rajesh Shavi.
Yeah.
Yeah.
Good evening, ma'am, and good evening, everybody.
Yeah.
Okay. I think Dr. Ganesh Prasad has covered everything, most of it.
Yes.
And I don't have much to say, much to add also.
No, sir.
So
I would ask you some
I'll be
questions.
ready to take the questions. Yeah.
Yes, sir. Yes, sir. I'm ready to ask you too. Thank you so much. So the first, my question is, Dr. Ganesh Prasad said about the first wave, and there's no waves, and as such, but as a normal person, as a general person, we would say that yes, the second wave is coming, and the third wave is coming, and all that stuff, right? So my question to you is, how different was the second wave in comparison to the first one? And when the patient presented with Delta variant, and how did the health system cope with it, sir? Like, what was your experience on that?
Yeah. So, I mean, like, first wave, we saw, it was very new to us, the disease itself. So, people presented with, the same routine, that fever, cough, cold, and all. And they get sicker later. And then they got breathless, and they went into a moderate disease where they had to be on oxygen and antiviral drugs, as well as on BiPAP and ventilators later. So, but that's the first wave. And the transmissibility of the virus, I thought, was less compared to the present second wave. And here, the rate of transmission of the virus and the disease was much more. And the people who got infected this time were too many. At the same time, the severity of the disease, initially it looked little lesser, but later, part of the disease, it looked really bad. And so many young people, like in the range of age range of 30 to 40, or even 45 till 50, also got infected more in this wave compared to the first wave. But the treatment remained the same. But this time, I thought the oxygen requirement and the machine requirement was more compared to the first wave.
Okay. Anything more, sir, you would like to add on this, or shall I go?
Yeah, I am not very sure about the third wave, when it's going to hit us, but I think we have to be ready for that.
Okay. So will this, whether it's a second variant or the next coming up, whatever will be in future, how will it be? Will those who are vaccinated will be affected by this, sir?
Yeah, they will be affected, but the severity of the disease will be less in them. I don't think they'll go into more severe complications of the disease if they are vaccinated fully. Okay. But if they're immunocompromised, they might go into complications. Okay. But I feel the severity of the disease will be less.
Okay. Okay. So if you get this Delta variant, or, if you're infected with this COVID, should one self-quarantine even if you don't have the symptoms? And when to discontinue home isolation? That's the question.
Yeah, home quarantine is a must. But once you're infected, home quarantine is must, at least for 2 weeks, 14 days. And the virus will remain in your throat for at least 18 days to 20 days. Okay. And you should be careful, at least for, according to me, for 3 weeks. And you should be under home quarantine, strict home quarantine, not to get exposed to anyone, even your house people.
Okay. So one more question. It seems very simple, but I think each one of us have this doubt within us. And the thing is, how to face it, and what are the precautions, and what is the prevention which one should take in this during the
one is regular wearing of masks and social distancing and use of sanitizers. At the same time, you should avoid going to public places as much as possible, not to get exposed, and take care of the elders. I mean, if you go out and come, please, take a good bath or wash yourself very well, and then come into contact with others.
So one more question which has come in with the same context. I think Dr. Ganesh Prasad explained it in his PowerPoint. But then if you could be a little more in detail, it would be helping the my friends back home. What are the precautions? What precautions should be taken by people with comorbidity?
Or comorbidities, uh, person or anyone with the comorbidities, better not to step out of the house till the pandemic or whatever waves you are talking settle down. That is one thing, first thing. And then if they have to go for work and you'll have outside the house, I'm like, if they want to move out of the house, then I think you have to be very careful. You have to get vaccinated first. Total, I mean, like both the vaccines you should take, and then you can step out of the house and then wear the mask and keep a safe social distance, and then be careful in going around in public places.
Okay. Thank you so much, Doc. And this one question, my friend wanted both the doctors, and they want the opinion of Dr. Rajesh Shavi and Dr. Ganesh Prasad. Let me just read out this question to you.
Yeah.
And they say people are stressed out with a lot of information and advisory floating around. As doctors, how would you advise patients to prepare themselves and the families in anticipating and coping with the treatment during and after the COVID infection if they get infected? So, should I read the question again, sir?
Yeah.
Please.
Please.
Because it's a very long question, so I thought let me read it again for you. Yes. Yeah. So this has come from people. So I'm just, I can't change the wording, so I have to read it out.
Yeah. Tell me.
People are stressed out with a lot of information and advisory floating around. As doctors, how would you advise patients to prepare themselves and the families in anticipating and coping with the treatments during and after the COVID infection if they get infected?
Okay. If they get infected, I mean, if they have a mild disease, they have to be home quarantine, and then take a regular medications, what is advised by your local authorities, and keep checking your oxygen saturation. Moment your oxygen saturation goes less than 94%, kindly seek attention of a doctor or go to the hospital. Don't wait. Most of the people who got infected and then went to a severe disease were who came late in the disease. So please don't neglect any symptoms. Moment you get breathlessness or the cough is more, and if you continue to have fever spikes, kindly seek attention of the doctor and go to the hospital immediately. You might be, in the moderate to severe disease. Okay, so you might have to, be admitted and take an antiviral drugs. And if the oxygen saturation is less, I think they start the oxygen on that. That is one thing. At the same time, moment you are tested positive, be away from your elders and any of the house family members, and then take attention of the local authorities or go to the hospital. That's what I think.
Okay. Dr. Ganesh Prasad, what's your take on this?
I could probably see two parts what they are asked in this particular question. But one is how are you going to prepare if the patients, one of them in the family has got COVID virus. That's what they meant. I think, as I said in the triage slide, I think they have to triage themselves in the family, within the family. So triaging in the sense, people who are immunosuppressants or immunocompromised, they should be taken care of well. In the sense, they should try to what is called as reverse quarantine. Reverse quarantine is a terminology that has been used for those who are not infected, but they will be treated as if they're infected and keep themselves locked in the house and not come out at all for next 14 to 15 days or unless one of the family members has got COVID virus. Though they may not have COVID virus infections at all, especially those who are immunocompromised. This is called as reverse quarantine. That means people who are not having COVID, but they have to quarantine themselves for 14 days. Behave similar to what way they are looking after in the house for a COVID positive patient, like not going near them, not touching the things that has been touched by those people with COVID till for 14 days when they come out of quarantine. So very similarly, they have to behave in such a way. So once those in the hospital, actually all the members have to be tested, number one. Do you triage yourself? Yes. Those with symptoms, with no symptoms, or minor symptoms, or moderate symptoms inside the family. But everyone should get the test done. It is safe for everybody. People who think they have no symptoms, they don't have no COVID at all. People even without symptoms might have COVID, and they might be harboring and give it to other people in the family. So better get tested irrespective of whichever family member has got positive. This gives a lot of security for the whole family. Don't get into a stigma. People think it is a stigma telling others that I have COVID. It is not.
Exactly.
I think it is a bravery. I think you should say people who had COVID. I think they should be very clear that tell others in the family or in the surroundings that they have COVID and they are quarantining themselves, trying to protect the whole community whom they are coming across. So
Yeah.
people with minor symptoms or moderate symptoms should go seek to the hospital, and they will go down to the hospital, and whatever the doctor says, they have to listen. As that presently there is no structured treatment protocol throughout the world. We just follow what has been given as a guideline, which is not a structured protocol or a structured therapy. We just follow the guidelines that has been given by WHO or ICMR in our country, and we just go with the way. Whether the results are going to be positive or negative, we can't guarantee as doctors. We, of course, act according to the whatever the signs and symptoms come up with the patient, and we go aggressively if the patient needs more treatment, like people with need of ventilator or need of ECMO, one of the something like a bypassing the heart and the lung, try to heal the lung with some medicines. We do that, of course, depending upon the severity of symptoms. And of course, the financial burden on this particular treatment is enormous. We understand that. But I think we should go with the doctors. We can't question why are you giving this treatment? Why are you not giving this treatment? Very difficult to say. Some of the colleagues from Indonesia had asked, they are giving one tablet called as Shavi in huge quantity there. I can't either guarantee that this is going to cure. I can't say this is a wrong therapy. I can't say this is a right therapy too. So we have to go with the expertise of particular treating doctor. And of course, you have to have full faith in the treating doctor. What he's doing should be correct. That's
Very,
all.
very true, Doc. Very true, Ganesh Prasad. Okay, my next question is addressed with why young people below 40 years of age pass away. They don't have any comorbidity situation. Why is it happening that it is not just affecting the older generation, of course, because they lack of immunity and what? Why are the ones who are below 40 getting affected and they pass away? It's a really very sad situation with this virus. What's the explanation to this, doctor?
Okay. I'll take up for this question because I feel in second waves, in the second wave, I think the people who are a little younger, like what you said, 30 to 40, 45, they got infected more. And the mobility was more, even the mortality also was comparatively more this time among this young population. I feel one of the reasons is they came to the hospital a little late, thinking they could manage at home. So they kept quiet till the disease became severe, and they neglected the few symptoms which they were harboring, like increased cough, even persisting fever. They thought it would come down with the water routine medications, and once they got breathless, they were not able to manage. Then they would come to the hospital, but that time it would be little late. If they had come little earlier, at least about 3-4 days earlier, what they had come before, probably so many lives would have saved. Okay. So then what happens, because the virus replicates so fast and affects the lung tissue, almost by the time they present to the hospital, almost 60 to 70%, even 80% of the lung would be gone. So then, putting them on oxygen, putting on these machines, and even the ventilator, it won't be very fruitful. That's what I feel.
So will you advise the youngster? Or
young people also, even they get symptoms. The moment they think the symptoms are not coming down within 4-5 days, please go to the hospital, get themselves checked, and CT scan and X-rays and a routine COVID markers they'll do, and accordingly they treat them. I think they shouldn't neglect themselves.
Okay, thank you, doctor. Thank you. So, there's one more question that when the COVID patients are at home, or one member is suffering, or the couple of them in the family is suffering, there's a tremendous amount of stress and anxiety in the family. So I know it's not a psychology session, but then would you like to share a few tips which would be, which my friends who are listening to me or will be benefited, that how should they manage the stress and how can they, keep their calm within
Yeah.
themselves? Do you have any?
So first thing, I mean, like the moment someone in the family gets tested positive, I mean, like, depending on his severity, either he can quarantine himself in the house, or to be on the safer side, he can get admitted in the hospital so that the other family members are not affected. Or if he can manage the home quarantine, I mean, like, other members shouldn't get frightened. I mean, like, you can give him the food and all that, but at the same time, keep them themselves away from the infected person. That is one thing. And there is no reason for anxiety as it is right now. I mean, like, only thing, moment the symptoms are not subsiding, people should think that they should visit the hospital or the doctor. That is one thing in their mind. They should always fix it. Okay. That's what I feel.
Okay.
And they can ask Dr. Ganesh Prasad's opinion also, please, on this.
Yeah, how to de-stress would be the thing, like, how should you stay calm? Is there any technique which would stay, you need to?
Yeah, I would say, I mean, to prevent infection, I would say, I mean, like, eat healthy food and take enough rest, okay, and do meditation, yoga, and little amount of exercise, all that. But at the same time, it is little difficult to do all those things. I mean, like, when someone is infected already and then you are under stress, okay. So what I feel is, I mean, like, do all these activities, I mean, like, as much as possible, okay, and then don't be frightened about this, okay. Everything will be all right. Only thing is just matter of time, because this is itself, I mean, like, it takes about 2 to 3 weeks for it to subside. So the patience is important.
Yeah. So I'm very sure, sir, because my Manthan with Saraswathi is also is be careful and not fearful. So let them not be fearful about the symptoms or fever. Stay calm, and then probably they can fight the thing. So I'm just taking a small break here. I want to welcome Mr. Suresh Vembu here.
Hi.
And there are a lot of questions which has come up on the chat. So Mr. Suresh Vembu would like to read up a few questions which has come up on the chat. So please go ahead, sir.
Yeah, thank you, Doctor Ganesh Prasad, Dr. Rajesh, Shavi. Thank you for coming on the show. I would like to read some of the questions on the chat box for you, for either of you to answer. There's a question from Mr. Sridhar K. Within a family, if anyone is infected, whether we can take the standard medicines recommended for some other patient in the same family, or every patient needs to be to consult the doctor first. Because I think now a lot of WhatsApp messages and lists going around. So the question is there a standard set of medicine to be taken, or every patient should consult the doctor first?
I think I'll just take this on this front. I think, so in this 1.5 year, the scientists are not so, I mean, they're not caught unaware. So they are, I think what they are asking the standard therapy is trying to give something called as azithromycin, vitamin C, zincovate, etc. So they think they can just copycat and just take this. And there's no evidence to say that these are going to really prevent COVID occurrence or COVID prevention or end of COVID. There is a new set of scientific data are coming up, what is called as MAB, that is called as monoclonal antibodies are coming up. This is being tried for the people in the same exactly the way what you asked in a similar question. Of course, it is not still out on in a big way as a scientific evidence, but the data is robust. Whoever is infected in the family, they with the mild symptoms too, even the close family members without COVID positivity can take this MAB to getting themselves infected with the virus. So there is one school of thought that is coming up. Of course, it comes with a cost. This monoclonal antibodies is basically stimulates our immunity cells and tries to prevent the virus getting into our body itself. So this is one area where the people are working on it. The scientists are working on it. Regarding copycatting the regular prescription, I don't think really is going to really help them. Might create more problems to them rather than getting exposed to unwanted antibiotics, getting exposed to unwanted agents that cannot be suiting to them. Best is to submit themselves to the doctor or the family physician whom they know. Tell them this is what has happened in the family and ask them for whatever the scientific evidence is there for those who have got no COVID in them. You can't just take some drugs. There's no drugs as of today, except for the MABs that I've been telling, that has been taken for preventing a virus entry.
So basically, again, following up on the same question, the question is proteins and D vitamins, how crucial to combat this virus? What is the optimum intake? And as a precautionary measure, can we start consuming vitamins, proteins, etc. regularly? Does it provide an extra safety ring in terms of good immunity?
Okay. I think as a physician, my colleague Dr. Rajesh might be having more input on this particular lines. But I like to put my thoughts in. There is nothing scale into a human body. You can put it inside them and find out how much of immunity they have. And none of these vitamins or proteins that can be entering or taken into our diet can tell us this amount of immunity has gone up, say 60% to 70% to 80%. There is no scale. So really meaning there is no evidence to say that you take over, eat your proteins in diet or overtake vitamins probably will help you in combating this virus. No, be normal as you are. Trying to eat a biologically balanced diet is what is need of the hour. Don't try to take more proteins, high proteins. People think by eating a lot of lamb meat or fish or whatever meat they come across, high protein diet in terms of vegetarian diet also can prevent this virus entry. No, the dietary thing is nothing to the viral entry or replication. It is not directly equal to our immunity. Immunity is something which is totally different thing, which is there in our body. And to the same extent, the 40 years or 39 for 30s, third decade of people who died, they're all just healthy in their own way. Really, nobody has tested the resilience of this lung of a person. The life is running for everybody. We don't stop and check ourselves. We just do a treadmill test for the heart. Beyond this, we don't do it. Stress test for every organs in the body. Just do a master health checkup, think everything is fine, is everything is fine. No, maybe those people who got unaware that their bodies are not really correct, they are the ones who probably passed away, thinking that they will come out because of their age. So I think we don't test ourselves to stress our each organ system to find out what is the resilience. So that is what it is. So eating things like that will not help you in your immunity boosters.
This particular event is also
Let's
being.
have Dr. Rajesh Shavi, because he's a physician. Let's see what's his opinion.
Yeah.
Dr. Rajesh Shavi, what's your opinion, sir?
Vitamins and antioxidants from physician.
Yeah.
No. You take an adequate amount of protein which is required. Okay. And you don't have to be extra cautious in taking extra amount of protein because especially meat protein. Meat protein, I mean, like, no, I don't suggest because if taking in excess quantities, it can affect the kidneys also to some extent. I mean, like, if you take extra proteins, which is not required. So take a normal diet and you can keep eggs in your diet. But at the same time, vitamin C and zinc, like, to keep yourself at least for them to have a placebo effect or whatever. So you can keep taking vitamin C and zinc. I don't mind. I mean, like, people taking vitamin C and zinc at least now till the pandemic comes down. Or during the wave, I mean, like, for 2 to 3 months you can consume. Okay, but don't consume it extra. Like, vitamin C about 500 mg twice a day. That should be okay. And zinc about 50 milligrams morning and evening. That should be enough. Don't be don't take it in excess quantities. That's the only thing.
Okay. Doctor, this event is also being streamed live on Facebook. So on Facebook, I have a question from Mr. Amit Bakshi. What is the dose of favipiravir for COVID patients? Favipiravir. Yeah. So the question from Mr. Amit Bakshi.
It's 1,800 mg for first day. And then followed by 400 mg BD, 800 mg BD twice a day for next 7 days.
Okay.
Thank you, Doctor. Over to you, Saraswathi, for further questions.
Okay, my question is, my friend had written to me that, it's a very, very simple and doctors may have a hearty laugh at it, but she wanted to know about it. That is there any chance that one can be exposed to the virus if they come up for a follow-up appointment?
Yeah, there is always a chance to get the virus. I mean, like, because hospitals I mean, like now you come across all kind of patients. So you might get infected also. So when you enter any hospital for that matter, I mean, take little extra precautions like wearing double masks and gloves, and if possible, face shield also.
Okay.
I mean, for this question, I should say hospitals are not manufacturing centers of COVID virus. Okay, they think we are having a huge factory of COVID virus and we are just getting into the system. No, I think there have to be more precautions in going to other places. I think hospital per se, in most of the hospitals, they follow moral code of conduct like guidelines. So if the person is not following, he might be at risk. This entering hospital for just a checkup, that is what I want to take away the fear from them. People are just keeping heart attacks in the house thinking they'll get COVID and they go to the hospital. Hospital are not the places to get a virus. Hospital are safer, definitely safer. There have been triaged into places today, better hospitals are triaged, COVID and non-COVID areas. Please go to the hospitals for any other symptoms apart from COVID you have. Please don't neglect your health. Don't think hospitals have harbors of COVID viruses and then they give it to others. No, other public places are enough to give the COVID virus to the places. So you have to follow guidelines. Wear mask, as he said, social distancing, wash your hands or even sanitize your hands when you come across something in object in the places. I'm sure hospital is not going to give you the virus.
Okay, great. So moving on to the next question, which has come in. When would you suggest an antibody or a serology, doctor, test? I mean, when would you suggest an antibody or a serology test? When would you suggest this?
Yeah.
I think I had put up the slide. I think Dr. Shavi will tell you.
Yeah. I know.
Yeah,
It was
I mean,
Dr. Ganesh Prasad, Dr. Ganesh Prasad presentation was in a nutshell. So probably this would be just, for the person who joined in late. So probably they would like to know this answer. So
yeah, you can check the antibodies now 3 weeks after the infection. I mean, like once you are infected, 3 weeks later, you can check your antibodies to check the levels of antibodies, especially IgG. I mean, that will give us an indication, like, to what extent you are, infected. Because people with mild disease, they have lesser antibodies compared to people who had a moderate or severe disease. So to have more antibodies in the blood, it is good that way.
Okay.
So,
so one more question is like, what is the side effects of all the steroids and the antibiotics given to the COVID patient?
Yeah, can I take up the question? Yeah.
Please, sir, please. Yeah.
See, one is I'll take up the steroids first. Okay, steroids. I mean, like, no, we have to give the steroids in COVID patients because it's a thromboinflammatory disease. In a sense, there is two components. One is the thrombosis, another one the inflammation. Because of actually the vascular endothelium is involved. Okay, that will trigger the thrombosis of the blood. In the sense, the blood becomes more thick and there's a more chances of getting blood clots, especially in the lungs, and can get in the heart also. People can get strokes. So to prevent that, we have to give blood thinners. And the inflammation is the one which is the other component of the COVID disease. To counter that, we have to give steroids, otherwise the inflammation will become more. And then the patient will succumb to the disease. So we have to give steroids in this case to prevent, is a life-saving drug in COVID. Okay, and we give usually for about 8 to 10 days. So during this period, if you use in moderate or whatever the dose, what is recommended, that's about 1 milligram per kg body weight of the steroid. Usually none of the complications arise. Only if you use the steroids for a longer time, I mean to say about 2 to 3 weeks later, also if you have continued the steroids, then what happens, you land up with the superadded infections. The secondary infections will be more common, like any of this bacterial, viral, fungal infection, everything comes into picture. And one more serious side effects is developing diabetes. And also the people with the hypertension, they tend to develop little uncontrolled hypertension. So when they develop this uncontrolled blood sugars or uncontrolled blood pressure, we usually tackle them with whatever routine medicines they are taking, along with the insulin. Okay, when they're in the hospital. And when they're getting discharged, because we'll be tapering the steroid dose, so they can continue their routine medicines. If need be, we'll put a small dose of insulin for some time till the effect of steroids goes. Usually the effect of steroids stays for about 2 to 3 days after the steroids are also tapered off. So till then, we'll give the steroids, insulin to counter the effect of steroids. And the BP will control with along with the routine medicines, whether to increase their medicines, dose of medications what they're taking, or we'll add up another medicines to control the BP. Okay. And the blood thinners anyway will continue for at least 3 weeks.
Okay.
Okay.
About the antibiotics, Doc?
Antibiotics, see, there are no side effects of antibiotics, but to cover the secondary bacterial infection, we give antibiotics for at least 7 to 8 days in COVID patients. And usually antibiotics will not cause any other side effects.
Thank you so much, doctor, for that wonderful explanation of the steroid, because many of my friends had addressed this steroid as a very a great question, because many number of questions were aroused on for steroids. So thank you so much for that wonderful explanation.
Thank you.
The next question, I think, will be moved.
Saraswati, there is one question being posted on the chat box.
Yeah, sure,
also, side effect of all these COVID treatments. This relates to hair loss is being seen in COVID patients after 2 to 3 months. Do you have any specific vitamin to be taken, or what should be done?
Yeah, I mean, hair loss is common. It is known to happen in COVID. It is not after 2 or 3 months. It can happen during, within first 1 or 2 weeks also of the illness. So you have to have a good amount of good food, balanced food, as well as you can take biotin and folic acid, those things to improve the hair growth.
I think any viral disease, can cause stress in the body. So it is not just for COVID virus alone. Any virus can cause asthenia, there is myalgia, weakness, and everything. And of course, hair loss can also happen. I think getting less stressed out is more important. The more you get stressed out, I think more you might have hair fall. And you can't blame the poor virus for everything. Some of the medications, for example, steroids can cause little hair loss because it has got some effects on the thing. And during those time of high acute illness, our protein deficiency is likely to occur. It's not just because we won't be given proteins, we won't be able to assimilate the proteins into the blood. So all these factors cause a hair loss. As you rightly pointed out, a biologically balanced diet after the viral event, and probably add on a biotin, which can probably boost your hair growth, can be a treatment for your hair loss.
There are a lot of questions being asked on vaccination. Maybe Saraswati, you want to take on this question of vaccination?
Yes. Yeah, so there's many of my friends back home, they posted on vaccination, sir. So I think the first question I would ask is Mr. Jigar online there? Mr. Jigar, I would allow the question of vaccination. You would take the first question, sir. Is he there?
Hello. Good evening, doctor.
Yeah. So could we have?
Good evening, Mrs. Saraswati.
Yes, sir.
Thank you very much for providing such a good platform to discuss the post-COVID effects and discussions about the COVID.
So your video is off, sir. Can we have you on the video?
Yeah, right. Yeah, sure.
Thank you. Thank you. Yeah.
Hello.
Hi.
So I'm from Jakarta, doctor, and here we are good friends of Mrs. Saraswati.
Yeah.
So my question is actually what happened that after taking the first shot of vaccine here, that was AstraZeneca vaccine here, after 3 weeks, I developed shingles, that is the chickenpox reactivating on my right torso. So, and then, I got the medicines and now it is almost recovered. But that time, as I was...
Are you a diabetic?
Yes, I'm a... Hello?
Okay. No, I think you have to control your sugars because the vaccine doesn't cause herpes zoster. And there is no immunity issues involved with the vaccine. Okay. So probably
when I was...
it's a coincidence, dental finding. I mean, illness what you had, probably because of your uncontrolled sugars, in case the sugars are not under control that time. Okay. So I think keep a check on your
Normally,
sugars.
I am not a
should be
sugar
okay.
diabetic patient, so and
Yeah, keep a check on the sugars.
far,
I think it should be okay. Yeah.
yes, because I
It's
read
not
on the
disadvantage of the
net
vaccine.
also on the searching.
I think, sir,
So there is one school
of
of thought that, like, if you give a vaccination, this of course is a lot of science in vaccinations also. I'm not going to the depth, and this should not make a misconception among the public that taking vaccination creates a disease. It is like, I'll just give a small example. Every day you open your gate when your paperman comes and throws the paper at your doorsteps. And every day you know that when you open the door, the paperman is throwing the paper. And one fine day you open the door, but the paperman is not there. The milkman is coming and giving the milk for you. So you have opened the door, but the reaction was that it was not a paperman, it was a milkman. Similarly, when a vaccination is given at times, there is something called as immune mismatch. They think that some other virus is likely to come, and they may not act for that virus which is coming. They'll keep quiet. So maybe your herpes was dormant, and your vaccination probably was probably having some sort of a mismanaging response on your immune system, that it allowed the herpes to come in. But you can't blame the vaccine. Don't take that the vaccination invited the thing. This is an immune system that is going on in the body, that your immune system went down for some reason because it is working for the COVID vaccine to make the antibodies in your body. So your levels of your immune system to some extent is a mismatch. So this invited your old chicken pox into your bloodstream, which was harboring in your somewhere in the body, and they got activated. So please don't take it wrong. Vaccine is not the cause of your thing. It is your immune system which is unable to balance the fighting response, has invited the shiggles, and then you got shiggles. At the same time, what Dr. Shavi said, you have to keep things in balance. You have to keep your hypertension, your diabetes well in control, and then only probably your immune response will be robust.
Yes, I also strongly believe the same thing, that because of that immune system was compromised somewhere, and then it got a chance to reactivate. So now any other further precautions are required?
No, I think there is a new thing what is called as you can check your antibody response to the vaccine, but not after the first vaccine. People do it and see what is your level of antibody response to the first vaccine. If it is very low, people even who have got the 2 vaccines, they had COVID virus infection. That is because the response for the vaccine was not adequate in them. So you have to individualize at one point of time. The US is already individualizing the vaccination booster. That's why somebody has in the chat have asked for, is there 3rd booster? And is there something new about this? No, there's nothing new about it. This is about the individual response for the vaccination that is there, which has been very quiescent response. It has not been a good response. So you need to have one more vaccine. So don't go with the same vaccine what you have taken. Supposing it is a Covishield, go for another vaccine for the 3rd dose, and probably it will boost your immunity. So it doesn't take that you have to mix in between like that. Don't take a first vaccine something, second vaccine something, and booster something. That is not allowed as per the guideline. Probably a guideline will be is already coming in by US itself, especially for our area. My area of interest is nephrology patients. So they are vaccinating the first and second dose with a similar vaccine, seeing the levels of antibodies, and then going for 3rd booster or a 3rd dose of vaccination with another vaccine, so that their immunity goes up.
Okay, thank you very much.
Thank you, Jigar Bhai.
Thank you.
Thank you. And my next question is again on vaccination. Thank you so much for explaining that in detail. Why different vaccine have different efficacy? Which one will you suggest for the kids? This is from a mother of a young child who writes that which is the vaccine you would suggest for the kids?
I am also a kid to my mother, but she has to specify the age of the child.
Okay, I don't know what's the age of the child. Maybe it's a teen or 13 years.
The guidelines is still less than 18 is still not true. The vaccination trial is going on in AIMS and other parts of the world. They have started giving it in US. It is once again a trial. It is not that it is a recommended thing. It is most of it coming as a phase 4 trial. So either of the vaccines, whichever is okay, so-called as immunocompetent people or immunocompromised children, etc., they are choosing the vaccine based on its efficacy and its side effects. So there's nothing like on mark, you take this vaccine, it's good for your kids. So there's not a guideline coming up. from the government of India or from US government or whichever WHO. So it is still in the trial. So we'll have to wait for the trial. But any vaccine come across which has been the same thing for the adult from 18 years to 65 years, any vaccine should work even for the children. I'm sure Dr. Shavi will have something to say on this.
I think Pfizer and Moderna, they're undertaking the trials. I think we'll have to wait for the results.
Okay.
And once the results are out, I think you can probably vaccinate the kids also.
Mhm.
And I think in India, it's a Covaxin which is being tried. I mean, still under the trials.
Sorry.
So we'll have to just wait.
Okay. Okay. So this one is again from one of my friend who got infected with COVID after 2 doses of vaccination. So her question is, why are most who have been vaccinated are now infected and tested COVID positive, even though they are only staying at home. They can be working outside or commuting also, but then they have had 2 doses of vaccination and still got infected with corona.
I think I answered this question just now.
Yeah,
because the levels of the antibodies may not be enough to fight the virus.
yeah.
So I think we'll have to, at one point of time, I think everyone have to go and check their antibody response. See how much of the vaccination has given them the amount of response in them.
Okay.
And then that will probably tell us that whether they're going to be robustly fighting the coronavirus or not robustly fighting the virus. But having taken the vaccine, people can't come down on their precautions. Maybe somewhere they have let down the precautions, are wearing the mask, thinking that they are vaccinated and they're not going to get infected. So I think that should not be the thing. I think that's how they must have got positive infection.
Okay.
Is it just one question, Dr. Ganesh Prasad? Is it because of this Delta variant? Is it that the Delta variant is not being effectively countered by some of the vaccines that people are getting, again infected by COVID? Is it that the efficacy of some of the vaccines against some of the variants is not good enough? Maybe Dr. Ganesh Prasad or
Actually,
Dr. Rajesh?
I'm not a virologist, but having said that, I think most of the vaccines covers everything. That is what the virologists have to say. There is nothing like the Zeta, the Kappa, the Lambda. Many things are coming in. It's not just the present Zeta virus variant of the vaccine of the virus itself. I think most of the vaccines covers most of the viruses as such. The mutations that is happening. But yes, some of the vaccines may not have pertinently acting on particular type of variants. But I think today they are working on a pan variant coronavirus vaccination. So I am sure that we are not going to have such problems. It will cover most of the variants because they know. For example, I just give you one example. There's one superstar, Rajinikanth, but he acts in the various movies in a different role. He becomes a doctor, he becomes a policeman, he becomes everything. Similarly, this virus has got the various roles to play. It just keeps mutating or changing its action and role in particular way. And I think the person is going to be the same. So you have an antibodies against it, it will fight the coronavirus. That's, I think, a simple example for them to think about. I think Dr. Shavi might add on to this.
Saraswathi ma'am, what was the severity of the disease who got infected of the second dose of vaccine?
She did not mention that.
See, the severity of the disease is much less. Even if you get a COVID infection after the vaccination. Yeah. So please go ahead with the vaccination. Don't worry about the infection you're contracting later. Okay. Because you have to have regular precautions, wearing masks when you're going to public places and social distancing. All that is required. But suppose even in case you get the disease also after the second dose of vaccine, the disease will be very mild, and that you don't have to worry about it.
Okay. So I think the next question, which has come from another friend, also will have a similar answer. So I would just like to read out, because I don't want to miss out any of them. So I read out the question as it came, sir. If someone got COVID asymptomatic after first vaccination, is it mandatory to wait for 3 months for the second vaccination? It carries on. What is the harm or risk if taken within 1 or 2 months after recovery, so that it is easier to travel, as most part of the places now require you to be fully vaccinated for entry? You want me to read the question again, sir?
Yeah, I think I got Let me think. Okay.
Yeah.
I mean, we can wait for the first 3 months after getting infected to take a vaccination, because you will already have a natural antibodies. Okay, so we'll have to. You can wait for 3 months after the infection. Suppose you are in a hurry, you have to go somewhere. If you need a vaccination certificate, you can go for a vaccination even after 2 months of the infection. I'm like, once you got the infection. Okay.
And if they get a little slight infection, say it says the same question is for those who got COVID, but with slight symptoms like throat pain and cold for 3-4 days.
Yeah. But no, whatever. So whether it's a mild or moderate, okay. So you can wait for 2 months.
Okay.
So 2 months after the infection, probably you can go ahead with the vaccination.
I think once again there's little bit science about this. People who have got infected even mild or moderate or severe, and they've already taken one vaccine, and they want to take a vaccine so fast, the body immunity will be already producing some antibodies. And they take a vaccination from outside, the body immunity will not stop or accept this vaccination for producing antibodies. It'll just go waste.
Yeah.
The vaccination will go waste because the innate immunity will itself is producing some antibodies. Okay. So the right time to take a vaccination is the innate immunity starts having a fall. That means our own antibodies will definitely have a fall. It will have a timeline, maybe 60 days or 50 days. That time you take a vaccination, then it will go booster. You take vaccination just for taking it and traveling it, or just for having taken in your mind, it is not going to work. It might go waste. Or if you're a little more clever, maybe you check your antibodies and then go for the second vaccination. As he said, that is the reason they're given this 2 months or 3 months timeline. You have that around 50 to 60 days of antibodies in your blood, and taking a vaccination will definitely go waste. So don't do that. Okay, mild, moderate, or severe, our body will produce antibodies. As he said, Dr. Shavi said, the more severe the infection, the more better the antibody response. So, for example, if a mild infection has got 10 units, the high infected person might have 50 units. Okay. And it will stay for longer time. Okay.
I think we are already running about 1 hour, 30 minutes into this particular presentation. It's getting more and more exciting, informative, and also many more questions are coming in. I just want to check with Dr. Shavi and Dr. Ganesh Prasad regarding your time availability. We don't want to hold you up against some more important assignments or patient.
Yeah.
So do you have time for another 10 minutes, doctor?
Another 5 to 10 minutes, yeah.
Okay, maybe. Yeah, let's maybe go to the main questions. Yeah, because I think
probably 1 or 2 questions each.
Yeah, just 2 questions to Dr. Shavi, 2 questions to Dr. Ganesh Prasad. Then we can close the thing, yeah?
Yes. It's a very specific question. So let me address to Dr. Shavi. I think it is related to diabetes. So I think, Dr. Shavi, I have 1, 2, 3 questions for you. Is it okay? And then probably we go to KG,
okay.
Dr. Ganesh Prasad.
Sure.
Yeah. So I think, Dr. Rajesh Shavi, you have addressed this, but still, maybe lightly you can touch upon it and explain it, and it's your choice. And the question goes like this: does COVID cause diabetes? Yes, you have already mentioned it, and people know that down there. A lot of patients are experiencing high levels of sugar and ketoacidosis. What should be the precautions and the treatment to be taken for new diabetic patients?
Yeah, as I said,
you are a diabetologist, sir. I think.
Yeah. People with COVID, I mean, we are bound to put them on steroids. So obviously, the sugars, even if they didn't have diabetes before, if they are having impaired glucose tolerance, so they'll develop a frank diabetes. Okay, the blood sugars will anyway go up. One is because of the infection, second is because of steroids. So that time, I mean, we usually give them insulin when they're in the hospital. Okay, and then we also cover with oral hypoglycemic agents, that's oral anti-diabetic drugs. And then we'll manage till the disease is under control and till the steroids are tapered. Then I think we'll send them on the required medications. Either it could be oral hypoglycemic, the sugars on higher side, we'll also put a small dose of insulin till the effect of steroids and till the sugars are under control.
Okay, because this year, I have witnessed it, and we have seen a huge wave of second COVID in this. There's another question, and you have been such an experienced person in Bangalore.
And the diabetic ketoacidosis, what she mentioned, I think we usually treat them with hydration, good amount of a lot of fluids. But at the same time, in the COVID patients, we can't rush fluids. So we had to judicially use the fluids, IV fluids. Okay, but because they need IV fluids as well as insulin, along with the cover of antibiotics. Yeah.
Okay. And one more question. I think you would be the best person to answer this question, Dr. Rajesh. Many patients who went into ventilators never made it. What were the complications and why could they not be saved? This is from Jakarta again.
They go into frank, what is called frank ARDS, where most of the lung gets damaged.
Okay.
So it is very difficult to wean them off the ventilator. The moment you try to wean them off the ventilator or reduce the settings of ventilator, they don't tolerate. They need the ventilator support for the survival. And they usually don't go along for a longer time on ventilator. Okay, unless we have the ECMO facilities and do the ECMO. But ECMO also, the survival rate is very less. Okay, because the main thing is the lungs are damaged totally.
Okay.
Okay, so at that point of time, it's very difficult to get them from there. It's very difficult.
Okay, it's a very sad
mainly it's because the lungs are damaged to such an extent that it's very difficult. It's very little we can do.
Okay.
Okay, I think we can ask questions for Dr. Ganesh Prasad.
Yes, yes.
Maybe wind up the conversation.
Yeah. Sure. Next one is coming from nephrology. I think just got this question. Patients with renal issues under dialysis are getting infected and many have passed away. What precautions need to be taken for these kind of patients who suffer from renal issues, Dr.
Yes. As a nephrologist, we had a lot of problems, especially handling with dialysis patients. In the first wave, what is called as first wave, a lot of patients got infected. And luckily, to some extent, many survived without much of a problem. Because there's one theory that these people are always in the state of immune, something like stimulating their immunity. They're in high inflammatory state. All these kidney patients on dialysis are in the inflammatory states. That means the body is trying to fight something at all times. So somewhat when something new virus came in, they had some form of fighting capacity, even though they must have some immunocompromised state or whatever. But I think this started weaning off in the second wave. So many had compromised lung issues and they expired while on dialysis. There is nothing special precautions on dialysis as such, but for going ahead with vaccination. So we are asking every patient on dialysis, even that was the first throughout the world, they started trying to vaccinate the people on cancer therapy and also on dialysis or in the post-transplant state or solid organ transplant patients. The reason that is they are more compromised or more susceptible for this virus. So vaccination is the only this treatment at this point of time to get protected from this virus. Having said, they need to follow the special guidelines, the social distancing, hand washing, masking at all times. All this has definitely to be followed. The virus can come into any time into the system because they are the ones who are visiting the hospital every third day or every second day for dialysis. And they are also coming across through public transport to arrive to the hospital. Not that only hospital, as I said, harbors the virus. It is also in the streets they are coming from can also harbor the virus. Many people have to come in their own, may not come in their own vehicle. They need to come on the public transport. So obviously, they are more susceptible. So they have to take all precautions to come into the dialysis centers for getting dialyzed. Once they get infected, they are separated or triaged in a place where COVID patients can get dialyzed separately. So other patients won't get infected. It's not like a wildfire that everybody gets the COVID. If one person in the hemodialysis area gets a COVID virus, they are triaged and kept away.
Good. So I think this will be the final question because there are a lot of people asking on chat group, and I'm sorry because we're running out of time. These doctors have taken very.
Let me just take a couple
my
of
last
questions.
question to Dr. Ganesh Prasad, Mr. Suresh.
Okay.
My last question. Otherwise, I'll be killed for not being asked this question. So sorry about that. Just the last question. What is long COVID? How to manage symptoms and issues which crop up subsequent to recovery? Who will take this question? I mean, I thought it was KGP or it could be done. Let's
there is nothing like a long COVID. I think number one is people, if you are talking about the RT-PCR being persistently positive, they are possibly taking the dead virus in their tissue. So the RT-PCR will keep coming positive. This happened in the first wave even in Bombay, especially in our patients on dialysis or even post-transplant. They had positive RT-PCR for around 3-4 months, and we were wondering what to do with them. They had minor symptoms or no symptoms, but the RT-PCR keep coming positive. So this is basically because they have tapped the dead virus and they have been testing it positive. Then we said, okay, no, this is a dead virus. That's why the RD-RP, that particular gene was tested, which was supposed to be a more of an active virus, not for the dead virus. So you can even segregate those dead virus coming as RT-PCR positive, and you can say, okay, this person is not having a live virus, but is having a dead virus. And these are the ones who are called as long COVID. Other way, once they get into the system, they take a long time to come out of the body. They get harbored into the kidney or in the bowels. They keep excreting the urine for 6 to 8 weeks, and in the motion for almost 12 weeks, they say. But they are not very effective. So these are the ones. That's why the China people have started taking the anal swabs, because they could find RT-PCR being positive even in the perianal area, the secretions that is coming out of the GI tract, that is the intestinal area, because they secrete even in the intestine. But this can go on for 3 months. So this can't be called as a long COVID. There's nothing like long COVID. COVID has got a specific incubation period. They die after certain times. Maybe there's now talking about reinfection with another variant. That is, of course, in few studies only, literature. It is not coming in a huge way. So don't take it wrong that COVID will take a long time to get cured. No. Unless until some other variants get into the same person, it is like split personality. So that doesn't happen so easily as of now in the COVID theory. So it is going to be one COVID virus, one vaccination, one trait, and that causes the infection. I think probably seals their answer. Long COVID. I'm sure Shavi might have the same thinking. Until he has
I mean, like I have had very few patients. We usually don't repeat a RT-PCR test, even moderate patients, unless they insist. And because we know if you pick up a dead virus, then again they say, what doc? I mean, like, no, RT-PCR is still positive. What should I do now? So only the recommendation initially was like those who are had a very severe disease, when they were getting discharged from the hospital, to repeat a RT-PCR, those who are on ventilator. Okay, so otherwise the moderate patients, mild to moderate patient, no need to repeat the RT-PCR. Okay, so that's it. Otherwise, I don't think there's an entity called long COVID. I don't know.
Okay. Thank you so much.
There's one question. I just got one question which I want to ask. It's on the chat box to Dr. Shavi. Does viral mutation happen by itself without being transmitted from another person? Does viral mutation happen by itself?
Yeah,
because now they're talking of so many mutations happening.
Yeah, it can mutate itself. I mean, like, no, it doesn't have to be transmitted to anyone to get mutated. The mutated virus can get transmitted to the other person if he's not adequately immunized.
Okay.
Okay, thank you.
I think we are coming up to the end of the session, and now that Dr. Rajesh Shavi and Dr. Ganesh Prasad have explained the cause of it and how to prevent yourself, what are the precautions to be taken, I'm sure the session would have been really beneficial to all my friends back home, back in Jakarta, and those who are here listening to us in India also. So I think I'm very grateful to Dr. Rajesh Shavi and Dr. Ganesh Prasad for giving me back my own self, and I'm talking to you on this day. I'm very thankful to you. I'm very grateful to you, and thank you so much to my friends and who have encouraged me with so many questions coming in, and you doctors for taking out your precious time and answering these questions in such a patient manner and such a elaborate way and such a understanding way and very simple terms, so that my friends could have understood all that what we have shared. Thank you very much for it. And finally, not the least, thank you so much, Mr. Suresh Wembu, for being behind the screens and helping me out with, so many things. Thank you very much. And namaste.
Yeah, thank you, Dr. Rajesh and Dr.
Thank you very much.
In case there are some more queries or something, I will maybe route it to you.
You can text us.
We would like to make those questions.
Yeah.
Okay. Thank you, Doctor. Thank you very much for taking your time.
Saraswathi. This is Saraswathi signing off and saying bye-bye.
Thank you. Thank you, ma'am. Thank
Thank
you.
you.
Thank you.
Thank you.
Selamat
Good night.
malam, everybody.
Bye.
Selamat malam,
Bye.
teman-teman.
Bye.
Thank you.
Terima kasih banyak.
Thank you.
Thank you, sir. Thank you.
Thank you.
Thank you.